actually never share information like this, but I need to rant, number one. And number two, I feel like the healthcare system right now is so broken. If you don't have somebody in your family who knows how to navigate the healthcare system or has some kind of patient advocacy, like, you're in trouble. I really wanted to share my experience in case you think that you are in the hospital and you are on cruise control and they are doing everything to take care of you at 100%, that you need to ask, you need to double check what has been done. So my mom fell at home Sunday in the morning. It is now Tuesday. So my sister-in-law was home with her at that time when she fell, and my sister called the ambulance. They went to the nearest hospital. She's an 82-year-old female who fell on her bottom, and her x-ray came up with subtrochanteric fracture. And they also did initial blood work. They also did a CT scan of her head. CT scan looked fine. Her blood work showed acute renal injury. The orthopedist was like, of course, we need to take her to the operating room, but we're just waiting for cardiac clearance because she has an elevated BUN and an elevated troponin. Clinically, she has no swelling. She clinically is not complaining of chest pain. So all of this happened in the morning because we were just like waiting for results to come back. I ended up going to the hospital in the afternoon because my brother was there, and my brother's like, oh, they already have all the medication information. They're putting everything in. So he's making it seem like everything's under control. So that's fine if you come in the afternoon. When I go there, she's still in the emergency room. Her blood pressure is like through the roof. It's like almost 200 over like 110. So I'm like, did y'all restart any of your home meds? Because she didn't get any home meds in the morning. They're like we entered into the system, but we're waiting for the doctor to sign off. And the doctor has not signed off on any of the orders. And then I'm like, well, she's also on insulin. Can y'all check her level? Her blood glucose was almost at like 400. They had done initial blood work and urine in the morning that was not followed up on. And other physicians in the family, they came in like intermittently before me. They were asking for results on some of the blood work, the urine, whether she has a dirty urine, and of course no antibiotics were running. My mom, of course, is in a lot of pain because she has a fracture. And so they're like, okay, we can give her some PR and pain medicine. And I'm saying she doesn't tolerate pain medications like at all. She will start to throw up, like to not give her anything strong. So they're going to give her Dilaudid. And of course, she is throwing up multiple times. She doesn't have any eye fluids. They are scared because her BNP level was high, even though clinically she has no swelling, no edema. But of course, she has a UTI, she has kidney insult, she is in pain. So several other reasons that a BNP can be high, but clinically looking very dry. Anyways, it's close to 11 o'clock and they're doing patchwork type stuff. I have work the next day and I have my kids at home, so I left to go home. The next morning, one of the cardiology nurse practitioners called. Thankful that she called. However, she was like, we're going to start back home meds and everything like that. And then she mentioned that she's restarting lisinopril. So I was like, how were her labs this morning? Because last night, the creatinine was like 2 point something. I could just go on and on about like how much of a nightmare it's been. And I am a pediatrician. The only adult work I do is for obesity medicine because I am board certified in obesity medicine. So here is me going in thinking adult medicine in the base of like a hospital setting, looking up on open evidence. I am fuming. I am so frustrated right now. And I'm really thinking like, do I keep her here in this hospital? What am I supposed to do? So anyways, 30 hours later, being super patient, they did finally get her upstairs into the room, out of the ER. Still, guess what? We're still waiting on cardiac clearance. The cardiologist still has not looked at the echocardiogram. I don't manage any adult medicine inpatient. I am looking things up on open evidence. It states that this is an urgent procedure that needs to be done. Outcomes are best when complete within 24 hours. We spent 30 hours in the ER. And we're still waiting past the 48-hour mark for cardiology just to read that echo. So she went in Sunday morning, and it is now Tuesday. She went in for her surgery. I will keep you guys updated. But I just wanted to really share my story with you guys because every single day and every part of the way, I'm having to ask, like, how are the labs? How were the results? Can somebody call me? And I cannot imagine if you are not in the medical field, you are trying to navigate this on your own. So important to have some kind of patient advocacy. My brothers who are non-medical, they're just sitting there chilling, thinking like she is being taken care of because she's in the hospital and and I am being a Karen. There's so much more I can talk about, but my brain is literally going to explode if I go into every little detail of every little thing. I will keep you guys updated. My mom should be coming out of surgery pretty soon, and I myself am just getting out of clinic, and I'm going to hop in the shower, and then I'm going to go to the hospital.